Psoriasis is a chronic, non-contagious skin disease. Its manifestations can range from a few spots on the body to extensive lesions. Unnoticed by the human eye, our skin is constantly changing. Without conscious effort, it protects us from various influences, warns us about changes in temperature, both external and internal, plays a role in the immune system, and performs many other functions. The skin is constantly renewing itself, and this is important to understand what psoriasis is. Normally, the skin renews itself once a month. With psoriasis, the skin tries to renew itself every 3-4 days. The shedding of scales can be so intense that it causes the appearance of bloody dew, known as the Auspitz sign. The cells that reach the surface are not fully functional, as they have not had enough time to mature. Psoriasis usually begins at a relatively young age, but it can occur at any time from the first year of life to old age. For some people, the risk of developing psoriasis is increased. This is especially true for those who have a close relative with the disease. A variety of factors can trigger psoriasis flare-ups, such as stress or taking certain medications. Injuries can cause the Koebner phenomenon, where new lesions appear at the site of trauma. The main modern treatment for psoriasis involves the use of medications and physiotherapy. Plasmapheresis is a technique used to remove toxic substances, large molecule compounds, and substances bound to protein. Not only toxins resulting from metabolic disorders are subject to removal, but also bacterial and viral endotoxins. There are two types: gravitational, which uses a centrifuge, and filtration, which is performed using plasma filters. The effect of ultraviolet rays is due to their depth of penetration and their impact on the production of inflammatory mediators and cytokines, which have immunosuppressive and anti-inflammatory properties. They also influence the induction of cell death in cells involved in the pathogenesis of the disease. Medium-wave ultraviolet rays mainly affect the superficial epidermal cells, while long-wave irradiation penetrates into the deeper layers of the skin, acting on dermal structures and cells of the inflammatory infiltrate. There are 4 types of phototherapy. This is a selective combination of medium-wave and long-wave radiation. This is narrowband therapy at the emission peak with a wavelength of 311 nm, narrow-spectrum long-wave irradiation at a wavelength of 370 nm, and PUVA photochemotherapy, which is the combined use of long-wave irradiation and photosensitizers. The term PUVA is formed from the initial letters of the English names of the components, PIP, Saralen, and UVA, which stands for long-wave ultraviolet spectrum. The concept of PUVA therapy existed as far back as ancient Egypt, when a special herbal decoction was used to treat skin diseases, increasing the skin sensitivity to sunlight. If you have psoriasis, try to protect yourself from infections and your skin from injuries. Also, avoid nervous tension and try to minimize contact with household chemicals. Do not be embarrassed by your condition. Do not focus your attention on the disease and its manifestations. It is better to try to identify the triggering factors and eliminate them. Psoriasis that covers less than 1% of the skin does not need to be treated, as this may awaken the disease. It is important to understand that abruptly stopping treatment can lead to unpredictable consequences. Therefore, before starting treatment, you should consider whether you will be able to see it through to the end. Unfortunately, a complete cure for psoriasis is impossible, but achieving a stable remission is quite attainable with modern medicine.